A Republican wonders whether colored people, his word, colored people, get coronavirus more because they don't know or refuse to wash their hands. In other words, are dirty immigrants more likely to get coronavirus and they happen to be the colored ones? This is the question from a guy who should never show his face in public again. His name is Steve Huffman. He's a Republican state senator in Ohio. Didn't really have to tell you he was a Republican. As some of you know, coronavirus is disproportionately hitting the non-white population of the United States. There are different reasons why. Some of our non-white populations in the U.S. have more underlying health conditions that can be linked to poverty. Often poverty brings with it poor health. Pre-existing conditions appear to predispose people to more serious cases of coronavirus. You then also have to account for sometimes having access to inferior medical services. There's a lot of different factors here, but the point is, we know that minorities, including Black Americans, are being disproportionately hit by coronavirus. During a hearing about racism, Ohio State Senator Steve Huffman asked, is it possible that the Black and colored population might be getting hit harder by coronavirus because they don't wash their hands as well as white people, essentially proposing the idea that these folks are dirtier. They're not washing their hands as well or as frequently. Now, get ready for this. Huffman is a doctor. He said, quote, my point is, I understand African Americans have a higher incidence of chronic conditions, and it makes them more susceptible to death from COVID. But why it doesn't make them more susceptible to just get COVID? Could it just be that African Americans or the colored population do not wash their hands as well as other groups or wear a mask or do not socially distance themselves? That could be the explanation of the higher incidence. Now, God, the Ohio Commission on Minority Health's director, Angela Dawson, said what Huffman is asserting is not the opinion of leading medical experts in this country. That probably doesn't come as a surprise to you. So either the implication is Black people don't wash their hands correctly because they don't know how, or Black people don't wash their hands correctly because they're dirty and they don't care to wash their hands. Pick your explanation as to what Steve Huffman is saying here. And then, of course, this reference to the colored population. Like, what year are we in again? And for me, this is more proof that we need more people from younger generations who it would never even occur to use this language in these positions of power. And it's also a reminder that just because you're a doctor doesn't mean you're necessarily smart. Look at some of the things Ben Carson believes, if you need proof of that. Now, one last thing. Let's, for a second, take seriously the question of, are there hand washing differences among populations? Because this has been studied. We're linking to one such study. And the conclusions from this study were that women tend to wash their hands more and better. In other words, using soap and scrubbing long enough. Women are better hand washers than men. And non-white people are better hand washers than white people. When this has been studied, disproportionately, white men are the worst offenders when it comes to bathroom hand washing. We're linking to this study in the description to the YouTube video for this story. Certainly something to think about. This guy should never show his face in public again.